Hey, Dave with Align Therapy here. I wanted to talk about a simple and easy exercise you can do if you have scoliosis, kyphosis, or even back pain with this one. We're doing a series of 10 exercises for scoliosis that are simple and easy, and I think this is number 6. And so we'll go through this exercise, but to view the other exercises in this series, look in the description. We have links for those other videos, so you can check those out and make sure that you see all of the simple and easy exercises that we've done. The reason I'm doing simple and easy exercises is I had a question on Facebook if we could do more simple and easy exercises that don't take a whole lot of time but give a little more bang for your buck as far as doing the exercises. So don't forget to subscribe and look for the other ones. We're going to be doing 4 more in this series, so hopefully they're helpful. This exercise is a side plank exercise. So a side plank can be very helpful for scoliosis and kyphosis. It's a way to strengthen the core muscles, specifically the muscles on the side of the core that usually get a little bit neglected. A lot of times when we think about core exercises, we're not thinking about the side muscles, the lateral muscles. If you think about scoliosis, we have a curve that goes side to side, and so we get weakness on we get weakness on both sides, the concave side and on the convex side. So when you're doing this side plank exercise, pay attention to how it feels. Pay attention to what you're feeling as you do the exercise, because one side is most likely going to feel stronger than the other side. So pay attention to that. Side planks can be done wrong. They can be done with bad form. Side planks are a fairly, I wouldn't say aggressive, but a fairly challenging exercise. And so just be aware of that if you are having back pain or you're having other symptoms, numbness and tingling or sciatica, and you try to do this and it increases those things, or something's just not feeling right, then just stop and talk to a healthcare professional, preferably someone trained in scoliosis specific exercise, a physical therapist, to go over why that's the case and address those things so that it doesn't increase any pain or soreness. I usually will progress my scoliosis patients to side planks, but I don't do it very quickly. And so we have to get to a certain point where they are strong enough and have enough stability. So be careful with this exercise. It's fairly challenging. I'm going to show you how to make it easier and how to make it harder, and so you can base where you are and figure out what level you should do. So let's go over a general side plank. So a side plank, most people know it as your legs are out straight and you're going to go from your elbow to your feet. I usually have people keep their hand on their hip because if you're forward like this, your shoulder is going to come forward. So hand on your hip, you're on your elbow, on the feet, and you raise up into a side plank position. So this is a side plank. Like I said, fairly challenging. To make this a little bit easier, I usually will have people bend their knees. So then when you go up, you're going from your knees to your elbow, so that there's not as much distance, there's not as much leverage on those muscles. When you do this though, make sure your knees aren't forward like this, because if you're doing this, you're not staying in a good line. You lose your lordosis and not good form. So knees go back, staying on the elbow, hand on your hip, raising up. You can do this where you hold it, so you can hold it for 30 seconds, or you can go up and down. So up and down where you touch the surface and you come back up. A couple of things to watch for. Number one is I don't want you going past where you're not horizontal, where you're in a good line. So if I pull up into a good line like this, my body's nice and straight. If I go too high, then I start to rotate or something like that. So we don't want to go higher than where you're straight. These side planks are meant to work the muscles on the side of the core. You'll feel other muscles working as well. You'll probably even feel your shoulder working a lot as you do this. But pay attention to your alignment. So if you have scoliosis and it's in the lumbar spine, you most likely have a rotation in your pelvis. You have a shift in the pelvis as well. So pay attention to that. So as you're doing this exercise, making sure you're taking that into account and you're not allowing your pelvis to rotate where it wants to go with the scoliosis. You're trying to keep it in neutral, in a good line. So be aware of that. That's a little bit harder to show on a video because that rotation is fairly, it's not that significant, and so in most people, and so it's a little hard to see. So if you do have a big lumbar curve and you have some imbalance in the pelvis, this might benefit from having someone get some other eyes on it while you're doing the exercise. So starting the exercise from the knees and the elbow, that's one progression. You can go just straight, elbow to your feet. Some people will stagger their feet for more stability. That creates more stability, so there's not as much, there's not as much instability. That does take some muscle work away, so I like to get to the point where you can do it with your feet on top of each other. You can do side planks where you're on your hand and raising up like this. It's a little hard to do on a squishy table. You can also do, and this is the one that I don't like to do because I do have weak hips, but you can do a side plank where you come up and then you raise the top leg up and bring it back down. All of those things challenge your ability to do the side plank a little bit more. There are probably a few hundred ways to do side planks. Mainly I'm looking at doing a side plank for strengthening the core muscles on the side. You'll notice that they become easier as you practice them, and feel free to add some difficulty to it. But really what we're looking for is keeping stability in that good alignment. So if you're doing something that's kind of a crazy side plank exercise and you lose that alignment, just be aware that it might not be benefiting your scoliosis as much. Probably still strengthening, but it may not be benefiting you scoliosis wise. So a couple of things to look for with other scoliosis curves. So if you have a thoracic scoliosis curve, your shoulder blades are going to be uneven. So that's actually one of the first things that people notice with thoracic scoliosis or scoliosis in this area of the back. One is that the shoulders tip, the other is the shoulder blades. One will be poking out more than the other side. So if you have that and you're doing a side plank, try and make sure your shoulder blades stay stable. So this is kind of a hard one for most people to learn how to control, because the shoulder blade naturally isn't held against the body on the convex side of the curve. It kind of pokes out from the back, and it's hard to control because it's not in a mechanical advantage position. So what you need to do is you need to probably have someone give you feedback on if this is happening. What we see is when you're in a side plank position, we'll see the shoulder blade wing out off of the body. I don't know that I can demonstrate this because I don't think mine does that. But if you're on your side and you're coming up and your shoulder blade, you probably can't see it, but my shoulder blade is kind of winged. You just need to stabilize that. So pushing down through the elbow to help set the shoulder blade in a better position. It takes a little bit of practice, but have somebody watch you if you have that curve type. Even if you don't, even if you have some weakness in the shoulder blades, it may be beneficial to have someone look at it while you're doing that exercise to see if your shoulder blade is being held against your body. If it's not being held against your body, then maybe you've gone too high level in the side plank. Maybe we need more shoulder blade stability before we do a side plank. Could be any of those things. So that's something to look at to make sure it's not getting out of alignment. Pelvis, making sure you're not rotated one way or the other. The other mistake that I see is when people put their hand in front because they're helping push up. It makes their shoulder on the top side go forward like that. So make sure that that's not happening. But just watch for good alignment. So hopefully that was helpful. Side planks are something that is talked about a lot online, and there was even a research study that showed that side planks can fix scoliosis. The problem is that research article was not a good research article. If you're thinking that you can do side planks to cure your scoliosis, leave a comment. I can talk to you about that. Look at the other videos that we've put in this series that could help you with having less pain and improving the stability of your scoliosis. So again, these aren't Schroth method or scoliosis specific exercises, but they can be helpful. These are common exercises that I give my patients. So hopefully it was helpful. Don't forget to subscribe, check out the other videos, and we'll see you next time.